Thank you so much, Mr. Fisher. Next, we'll hear from Ms. Kamari Stanley. She is going to provide information about the PACT Act, and she's one of our excellent navigators here. She is also stationed out in the hallway, so she's serving in a dual capacity today. So we thank her for her time, and please give her a warm listen. Thank you.
Good morning, everybody. Good morning. Like Ms. Cook said, my name is Kamari Stanley, and I'm a social worker and one of the PACT Act navigators here for the Atlanta VA healthcare system. So I know the PACT Act is about a year old now, but I'm still gonna share some information for those of you who may have questions or aren't too familiar with the PACT Act. And excuse me if some of the information is repeated, because I know Ms. Seelhammer did cover some of the PACT Act information earlier. But the PACT Act was a law that was passed back in August of 2022, and it expands and extends eligibility for VA healthcare for veterans who had toxic exposures, and more specifically, veterans from Vietnam, Gulf War, and post 9/11 eras. It added over 20 presumptive conditions for burn pits, Agent Orange, and other toxic exposures. And again, presumptive means that when you go to file your claim for that specific concern, you don't have to prove a service connection. The PACT Act also requires the VA to provide what we call a toxic exposure screening for every veteran that's enrolled in VA healthcare. And I'll talk more about what the toxic exposure screen is after this slide. And if you aren't sure if you've had a toxic exposure screen or maybe know that you haven't, you can come visit me in the hallway and we can talk about getting you connected with a provider to complete that screen for you. The PACT Act also helps us improve research, staff education, and treatment related to toxic exposures, and it makes more veterans eligible for VA healthcare and other PACT Act related benefits, including disability claims. So since November of 2022, VA healthcare clinics throughout the country have completed over 5 million toxic exposure screens, and the Atlanta VA healthcare system alone has completed over 90,000. Our goal is to provide a toxic exposure screen to every veteran and encourage veterans who may not already be enrolled in healthcare to get enrolled and complete a toxic exposure screen so that we can continue to provide the best exposure-informed care so that our veterans have earned and deserve. The toxic exposure screen is a brief 5 to 10 minute conversation that you have between your primary care provider typically. And it's where you discuss any environmental hazards that you may have been exposed to during your service. This will be due at least every 5 years for every veteran who completes one here at the VA. Now, I think it's important to note that there's been a very common misconception that the toxic exposure screen is an examination to determine or diagnose what you may have been exposed to during your service. Unfortunately, that kind of screening does not exist, but what the toxic exposure screen is a brief conversation between the veteran and the healthcare provider, and it allows the veteran an opportunity to disclose things that were in your military service environment, so that way we can provide exposure-informed care. During the toxic exposure screen, you will be offered connection and linkages to benefits, one of our 6 registry exams, and clinical resources to support your needs. And your responses to the toxic exposure screen are recorded as a part of your VA medical record, and you're encouraged to share any exposure-related health concerns with your healthcare provider, so that way you can receive exposure-informed care. There is no formal sign-up process for the PACT Act apart from the toxic exposure screen and applying for benefits for your exposure-related conditions. But if anybody has any questions, you can always contact the PACT Act team at 404-321-6111 at extension 206300, so that way we can assist you further and discuss your specific concerns. And I'll also put that number up at the end here. So I, along with our VBA partners, again, are here outside in the lobby to provide information about toxic exposure screening and VA benefits. So we encourage anybody that has any questions or concerns about any of those things to visit us outside. Last year, we completed about 35 outreaches throughout our very large catchment area here in Atlanta in both urban and rural settings to help spread the word about the PACT Act. So this year, we will continue to partner with our VSOs and our community organizations, and we'll be posting about upcoming events like these up here on the VA calendar and VA social media. So just be on the lookout for upcoming events that you or somebody that you may know can benefit from. And then if you know of anybody who has a community organization that wants us to partner with them for their event, please give our office a call as soon as you can. And if we can do it, we'll work it out. And again, here is the contact information for the PACT Act team. So if you guys have any questions about the PACT Act or toxic exposure screening, you can give us a call. Thank you.
All right, thank